you'd like just whenever you're ready.
Okay. Hi, and welcome to part 2 of the webinar series for the pre-work session for the Southwest HealthLinks Learning Collaborative. My name is Alpaugh-Bishop. I'm the project manager with HealthLinks across the Southwest, and I'm going to take you through this session. Here is really just running you through an overview of the HealthLinks Learning Collaborative and how it really came to be. So the HealthLinks Leadership Collaborative is a group of leaders from across the Southwest LHIN that meet monthly to really guide the implementation of HealthLinks across the Southwest. And that group really recognized a need to create some opportunities for the teams that are going to be going out and doing coordinated care planning as part of the HealthLinks work. So they identified an opportunity for interdisciplinary teams to really come together, share their experiences, and learn from each other, and also recognize experts in the topic areas for which the focus of the Learning Collaborative is on. They also recognized an important opportunity to help build the team members' capacity for quality improvement techniques and change management techniques. The following next 2 slides identify what the learning objectives are for the Learning Collaborative itself. There's a hope that by the end of the Learning Collaborative that participants will definitely know how to and feel empowered to and have the skills to create collaborative coordinated care plans, which would also include how to best identify patients that would benefit from a coordinated care planning. In addition, we would hope that all participants would understand how to best access free resources, so those resources that would help assist patients and professionals with chronic disease management, but also some general knowledge and skills that would help with the coordinated care planning itself. As an example, self-management techniques. Continuing on, the third learning objective is really about team members all feeling like they are empowered and understand how to best approach to improve outcomes for patients with COPD using a collaborative approach. In addition, being able to implement best practices or guidelines for those individuals that they interact with that have COPD. And it's not necessarily about the Learning Collaborative going through what the best practices are, but more that practical piece about how to implement those best practices. The Learning Collaborative approach itself has a few different pieces to it. So essentially, it's a structured approach to quality improvement that is based on the IHI Breakthrough Series methodology. And to quote IHI, it allows for the spread of best practices in healthcare through structures and opportunities to share experiences within and across teams. It has been successfully applied to other initiatives here across the Southwest, some of those which you may be familiar with. So some examples include the Flow Collaborative, Partnership for Health, and Residents First. All of those initiatives did implement a Learning Collaborative with success. There are a few key components entailed in a Learning Collaborative. The first, and maybe the most important, is really the creation of the interdisciplinary teams. The second is pre-learning sessions with some preparatory activities. So this webinar, as an example, is one of those pre-learning sessions, and that's key and common across learning collaboratives. The structure of this learning collaborative involves 3 one-day learning sessions, which is indicated in bullet number 3. There are team action periods in between each of the learning sessions that are supported by a quality improvement coach. The wrap of the Learning Collaborative includes a one-day outcomes event where teams can come together and share and summarize their learnings from the Learning Collaborative experience. There's certainly an integration of the improvement model and plan, do, study, act cycles within the Learning Collaborative. And there's a flexibility in the structure of the Learning Collaborative itself, meaning that as teams are making their way through the Learning Collaborative, they can somewhat have an input into how the Learning Collaborative develops and is structured moving forward. This next slide really just summarizes the Learning Collaborative in a visual. So as we mentioned, you can see on the visual there are 3 different learning sessions and then a closeout outcomes event. If we get into a little more detail and we look at session number 1, we can see the topics for that session. So the topics include COPD, coordinated care planning, or CCP for short, quality improvement models and tools, and self-management. And then in between session number 1 and session number 2, over a 3 to 4 month period, is when the teams actually come together to apply the learning from learning session number 1, including the Plan, Do, Study, Act cycle. And then you can see the progression into learning session number 2, where the suggested topics include vascular and CHF, some change management, and also some information about experience-based design. Again, you can see the cycle flowing between session number 2 and session number 3, that we have this action period where teams again get to go out and PDSA the information and techniques and knowledge that they've learned. As we transition into learning session number 3 then, the suggested topics include senior frail elderly, medication reconciliation, and experience-based design. And then again, the action period where the teams come together and apply the learnings from learning session number 3, and then again followed by the outcomes event. And this is really an opportunity for teams to come together at the closure of the learning collaborative to share their experiences and learn from each other, and also potentially mentor new teams. The HealthLinks approach across the Southwest is in a phased approach, and so that approach really feeds well into this outcomes event, because it provides us the opportunity for those teams that are further on in their HealthLink journey to mentor the other teams and the other geographies that are further behind in their HealthLink journey. And you can see at the bottom of the slide here, there are some supports that are basically woven throughout the entire learning collaborative, and we've talked about a few of those already. In terms of the structure of the learning collaborative, it's really about bringing teams together, and I've mentioned that previously, to really learn from each other and learn with each other over a short time period. Learning collaboratives can span anywhere typically from 6 to 15 months, and for the HealthLinks Learning Collaborative, we're leaning toward the longer end of that continuum. All team members are certainly encouraged to attend the learning sessions. As you can imagine, it is optimal if all team members are able to attend all 3 of the learning sessions and the outcomes event. There are structured sessions which are used to teach practical approaches to improving the management of commonly encountered problems, and I think the key word in that line is this practical piece. So again, not so much about sharing of the best practices, but really how to implement those best practices and make the learning as practical as possible. Moving on to the next slide, which is a continuation of the structure of the learning collaborative. Essentially, participants are equipped and empowered to return back to the field, to their practices, and test out the new approaches that they've learned. There is quality improvement coaching support, and so the teams will receive that at an interval that's appropriate, likely monthly. And team members may also communicate more regularly through web-based tools, virtual meetings, etc. And that's where some of that flexibility comes into play, that the teams can decide what works best for them in terms of meeting frequency and how they want to go about doing that. Teams can certainly expect to see the benefits in short time frames. And the last slide here is really about team commitment. So we want to be upfront that there is a certain commitment to experiencing the learning collaborative. So outside of the 3 one-day sessions and the one-day outcomes event, we've talked a lot about the action periods in between those sessions and in between the last session and the outcomes event. And those are termed the action periods. During this time, there would be an expectation that teams would come together to schedule time together to actually practice all the learning. So implementing PDSAs and then talking about how those went and tracking their results and communicating their results out. So there is a time commitment associated with that part of the work as well. And essentially that wraps up part 2 of the webinar series for the pre-work for the HealthLinks Learning Collaborative. Thank you for joining me, and congratulations on being halfway done your pre-work session. Please stay tuned for Rachel and Nicole as they take you through the HealthLinks quality improvement approach.